The broadcast is now starting. All attendees are in listen-only mode.
Good morning or good afternoon, depending on where you're joining from. We're ready to go here. Thank you for joining us today for our webinar, Offering Your Patients Choice Improves Outcomes for Everyone. My name is Scott McDonald, and I'm the Marketing Director for Strata Health, and I'll be your moderator today. Today's webinar is being presented by Strata Health, where we are one platform solution for all your patients' transition of care needs. Before I introduce your speakers, I would like to go over a few housekeeping topics. Today's webinar is being recorded. We will be able to share a link with you after the event is complete. With that, we welcome you to revisit the content with yourself and share it with colleagues as well. Slides are available upon request. While everyone will be on mute during the webinar, we invite you to comment and send your questions via the Q&A chat box on your screen. If you think of a question for the speakers at any point, just type it there, and I or Ali will either hold it for you at the discussion portion at the end of the event, or if we run out of time, we'll email an answer out to you directly. So today, we're pleased to have three members of the Strata Health team presenting. Today's speakers include Art Nicholas, the Chief Commercial Officer here at Strata Health. Art has 20 years plus experience in the healthcare and IT field, including leadership roles at Nuance Communications, Interlace Health, and now Strata Health. Alek Puk will also be speaking and demonstrating our solution today. He has over 5 years working with post-acute care organizations here at Strata Health and has worked with hundreds of clients since taking his position here. Also joining us today to address any questions you may have are Maddie Powell, who heads up our customer success program for post-acute care organizations, and Ali Melendez, who coordinates our outreach to new post-acute care clients and is a member of our data acquisition team. At this time, I'm going to hand the floor over to Art, who is going to start the presentation. Art, it's all yours.
Thank you, Scott. You know, when we talk about offering patients informed choice, what do we mean by that? Essentially, what we're saying is that patients should have input based on accurate information on who should be providing healthcare services once they leave your setting. When it comes to patients leaving hospitals, this process is integral in terms of how patients get referred to your organizations, for example. Today, we're going to spend a bit of time understanding what the regulations are surrounding this process, what is strongly recommended, and practical ways to accommodate the goal of having patients make these informed choices. We'll show you during Alek's demonstration a straightforward way to accomplish these goals. When it comes to regulation, CMS began to provide more clarity in terms of what the expectations were or are for discharge planning in 2019. We've cited a number of CMS regulations and publications here in order to help you share this within your organizations because there's been a lot of confusion. A good reason for this confusion is that these were launched and finalized and approved in the fall of 2019. And then guess what happened shortly thereafter? COVID hit and we had a public health emergency and a number of these rules and regulations were suspended for a period of time. One of the areas that we found that is little known or isn't completely understood is that these regulations related to a patient being involved in their choice of care after they leave an acute setting is that it not only is required of hospitals, but also long-term care hospitals, inpatient rehabilitation facilities, and home health agencies, among others that you see listed on this page. That's something that often is missed by organizations. Everyone assumes it's just the major hospitals that have to supply this information during their discharge process. Some other regulatory considerations, just drilling into this a little bit more, the Impact Act and what its requirements were, including key performance data, such as the star ratings that are required, that patients have access to that so they can understand what ratings have each organization has accrued. The Joint Commission, which is not a governing body, but it is a commissioning body, has said that all these organizations should be providing a list of providers in the geographic area of the patient and clearly document in the EHR that this list was made available. Another organization, NIAHO, is also making the same kind of recommendations and strong urgings in terms of their clients that they adhere to this. So I mentioned earlier that waivers were put in place for the public health emergency, or PHE. This was done because, as we all know, we had a unique once-in-a-century pandemic that caused healthcare to be delivered in a very, very different format and fashion than in prior times. And so waivers were put in place for a number of different things, including those things related to discharge planning, such as informed patient of choice and other areas. But as we've heard from noted speakers on a recent webinar put on by the Athena Forum, just because those waivers are still in place, it's not really necessarily proper that facilities and organizations continue to ignore the intent of the rules. As Dr. Hirsch reminded everyone, if you're able to take care of and provide this capability of informed patient choice, you should be doing so. Same with Dr. Hopkins. At the end of the day, they both reminded us what we all should be doing as we're related in healthcare is to remember what's in the best interest of the patient, what's going to provide them with the best care output, and we should engage in those practices as best we can. What else have we been hearing? Even though those waivers are still in place, we're hearing in different areas of the country that hospitals are moving back to providing pre-waiver practices for transitions of care. We've heard education going on out in California advising not just hospitals, but other organizations in healthcare that they too should be moving away from the waiver behavior back to what was supposed to be in place beforehand. We've seen the patient experience has taken a hit throughout COVID, according to the Leapfrog group. And part of the reason for that is patients have felt in all areas of care that they've been kind of rushed through things. Things haven't been as transparent. They haven't felt they've been in as much control of their own healthcare. And this is something that we as a healthcare ecosystem need to work to reverse as we get out of the pandemic. We found that a hospital in Florida was encouraged by one of the commissioning bodies to really move away from their current practice and back to documenting choice as quickly as possible. And in the middle of last month, CMS themselves posted an update on their blog, basically telling us that the PHE is going to end soon and waivers are going to be removed. And therefore, they're advising organizations to start putting plans in place to be compliant with these pre-PHE, that's a tongue twister, regulations. So basically, governing bodies, commissioning bodies are all saying, as well as consultants are always saying, it's time to put a plan together to make patient choice available. Again, why is this all important? You know, as we talked about, a number of you attending today are getting a good portion of your referrals from these hospitals. The hospitals want to make sure that they have an effective discharge plan for decreasing the chances of readmission to the hospital, managing the length of stay, and helping in the overall recovery. These are very similar goals that your organization should have. If you want to have a real good relationship with the hospitals that are sending referrals, you obviously want to do your best to make sure that the care that your patients receive when they leave your organization are as good a match as possible. We've seen that in general, increased patient engagement has proven to improve overall outcomes. If patients are involved in their care, they feel like they're a part of the process, they're much more likely to adhere to the recommendations, and they tend to have much better outcomes. As I said earlier, we should never forget that by involving the patients and providing them with choice, which is what CMS in 2019 had really encouraged, is doing the right thing for the patients and their families. So we always should put that first and foremost in the front of our minds, because at the end of the day, it leads to positive outcomes for all of us. So I've outlined what the challenges are and what's going to be expected of you if you're not already providing informed patient choice at this point in time. We're going to shift gears a little bit and talk about a specific solution that Strata Health has. Many of you are familiar with it because your organizations are in the Strata Search directory that over 300 hospitals are using today to provide choice to patients in a hospital setting. Alek is going to take us a demonstration of how your organization can use search as a tool to help your patients make informed decisions about their next level of care when they leave your facilities.
Awesome. Yeah, I can run through that demo. Do you want to make me the presenter?
I'm doing that right now.
Awesome. Let me get this screen going. Okay. So it should be showing this window. Okay, I think it's showing. Can you see that, Art, and everybody else?
Yes, perfect.
Awesome. So hello, everybody. This is Alek. I've probably worked with some of you guys in the past before. And you might have actually seen this system. I've probably demoed it to some of you guys before in the past, but this is our tool. This is our Strata Health system. So basically it's what we use to, help discharge patients and help that process. I'm logged in as a hospital here, but obviously we're going to be offering that to you guys as something where you guys can use this tool to help facilitate that, discharge basically to home health agencies, hospice agencies, whoever you're going to be sending that to. So I'm going to run kind of a general home health search here, as if I was sitting down with a patient and handing them this tablet and helping figure out where they're going to go for home health care. I might also run like a hospice search too. If you guys haven't seen this before, want to get in more depth of your specific area, because I'm just going to pick a zip code, feel free to reach out to me and I can always run through any search you guys want with this tablet system. So feel free to reach out to me for that. But yeah, I'll run through that home health search now. So this is kind of the first stage here and what we're going to look at right away. So obviously it's a super easy one. We're just deciding what we need, home health, hospice, that sort of thing. So I'm going to click home health and click next. Next screen here is going to be the zip code where we type in the home health zip code that patient's looking for. You can use a nearby zip code, far away zip code. It doesn't matter. In our ecosystem, we have all of the zip codes that these home health agencies, hospice agencies that they service already in there. We've done the work, called through and gathered it to try to make it as accurate as possible. So I'm just going to type in a zip code in Arizona that I was working with earlier, type 85054. Load this up here. And then the next screen here is going to be the insurance filter. So kind of same thing with zip codes. We also have all the insurances that these companies work with here to make it very easy to find that right type of care for that patient. So you can narrow it down specifically to their insurance that they have. I'm going to leave that one blank for now. And then the next screen here is the service filter for specific needs. So same thing here. These numbers that you see next to the names, that's how many people take that specific or do that specific service, I guess, in this case. So, bariatrics work. Let me move this cursor up. I don't know if you'll be able to see the cursor, but bariatrics work, it says 26 next to it. So there's 26 people that do that sort of work. So it helps narrow it down. You can see right off the top how many people do that specific thing. Once the screen is selected, it's going to generate that full list here. In this case, home health agencies at that zip code that match all the criteria that I had put in before. So we'll let that load up, and then I'll show you what that looks like. So this is it loaded up here. These are right off the top home health agencies that can help out that patient to that criteria that I had put in. So this is going to be a full list here of all of that. I can scroll down. I'll tap on one of these in a second, but I just want to show you, a full list here of all the different options that patient might have. So you can see a lot of information about them here. We have different types of listings. There's basic listings, premium listings. I might have discussed this with you guys in the past before. But that's kind of what this looks like in this case as a home health search. So I'll click on one of these listings here, show you kind of some of that additional built-in information that we collected over the years, basically using the system and reaching out to post-acute care providers like your guys' own post-acute care providers. But yeah, so this here, when it's clicked on, it's going to have, some the name at the top. You're going to be able to put in description here. You can add up to 1,000 words. So home health agencies, hospice agencies, things like that. We've already gathered this information, so it's pretty well built down information that the patient can see and kind of take in. So it's not just like a simple, here's a name, here's a phone number, call these people. There's a lot of additional content in these listings as well. So it's very personal to the patient. You'll have photos. These can be scrolled through, clicked on. Special programs and features. Every post-acute care provider that has one of these listings can add up to 12 of these as well. Sometimes with bullet points, with paragraphs, patient testimonials, up to 5 of those. For our home health agencies, we're going to have the CMS care ratings built right into that. That's updated automatically with CMS. So you guys will have that information accurate that you would be able to present to your patients when you're helping them make that decision. You can comment on the CMS ratings, so some of our post-acute care providers will put a comment there and talk about them. And then there's brochures on these listings as well. So you could click view and it would load up a full brochure here for the home health agency. And those are kind of some of the content features that are built into the listing itself. So when that patient's making that decision, like I said before, it's more than just like a name and a number to call or a piece of paper that you would hand to them. This is something that's very personal. We get a lot of positive feedback from patients saying things like that as well. You'll also have below that just some additional information, contact people, as well as the total list here of services provided and insurances as well. And then on our system as well on the back end, I'm not necessarily going to be showing that right now, but everything is up to date in real time. So when someone goes in and changes one of their insurances that they take, that will reflect right away on our tablet. So this information isn't out of date. It's not something we're going to have to necessarily call and verify every time. So it's super up to date, real time information. So it's super cool for that as well. But yeah, like I said, this is a home health search here. I'll also just run a hospice search just so you guys can see. It's going to look very similar, but I'll just click it again. And also, like I said before, if anyone wants to see any sort of specific search in any area, if you're wondering, what it looks like in your specific area, how built out it is, feel free to reach out to any of us and we can walk you through that. But let me click hospice here and then type in a zip code. So I'll type in 85054 and then click next. And then same steps, insurance filter, there's 64 people that take Medicare, 20 people AARP, things like that, like we talked about before. And then service filter, these are specific for hospice now. So they're obviously not going to be the home health services. These are going to be hospice services, so palliative care, bariatrics works there again, but then you have wound care, things like that. So again, there's 42 people that do palliative care. So it's good to know that right off the bat. You can also manually search for things. This list is pretty straightforward. There's 6 of them. If it was bigger than that, you can just type in up there, search by service name and find what you're looking for right there to narrow it down. And again, when I click next, this is going to be the hospice agencies in that area. So you'll see them there. And then you can go through and see all that information about them and learn about those agencies right through our system, just like you could with home health. But yeah, overall, that's what the system looks like. And it's a tool that hospitals have been using for years now. They love it. The patients love it. And it would be something that'd be awesome to see, you guys using it as well to help facilitate that discharge, make it very personal for those patients. But I think that was pretty much it on my side for the demonstration. Did you want me to run through anything else?
No, Alec, thank you. That was a great job. If you wouldn't mind making me presenter again, I've just got a little bit more information to share with folks.
Sure, give me 1 second. GoToMeeting isn't one I use all the time, so I gotta find it. All right, there we go. Let's see, Art, and you are now the presenter.
All right.
At least you should be. That work?
Yes, it does. So
Awesome.
Thank you very much.
Yep, thanks guys. Hopefully I'll talk to you guys soon.
Oops. So just as a reminder, and Alec commented on some of this earlier, we've got a number of solutions that we can make available for your organizations, starting with software solutions. You saw Search today. We also have another program called Sign, which gives you the ability to have patients sign whatever required forms are needed related to the discharge electronically and stored automatically with the record in the EHR. And we have Send, which allows communication between your organization and the people you're sending referrals to help you identify who's ready to receive someone, answer any questions, share information from your EHR to those folks, and secure a successful referral. And as you saw, and maybe some of you even saw your own organization listed during the demonstration, we have a digital directory that makes up search and is used in over 300 hospitals today. This provides post-acute care organizations a great way to inform those hospital case managers and their patients about your services and offerings, and those are delivered with an iPad to the hospitals. We have the ability to create premium listings, and we also have offerings related to multi-location listings available for your organizations if you're not already a part of our program. And as we mentioned earlier, we're going to handle questions and answers now, and I've got Allie's contact information for anyone that wants to talk in addition to these questions and wants to schedule time for a deeper demonstration, as well as our LinkedIn page to keep an eye on what Strata Health is up to. Allie, do we have any questions at this time?
I'm muted. Yeah, so we have a couple right here. It looks like someone was asking if the search program that we have demonstrated is the same one that the hospitals are using. And so the answer to that is yes. This is the exact same program that hospitals are using to provide patient choice. So yeah, we're being able to give this ability to the SNFs and LTACs in the country to have that opportunity as well. Let's see. Then we have, this one says, if they have more than one location, are we able to get search set up for them in all of them at the same time? The answer to that will also be yes. We could elaborate further on that. You just have to contact me and we can schedule a quick meeting to get that, expanded upon. On my email and my phone number is right there. Let's see, what else do we have here? And then if you want any other pricing on information, just contact me. We'll set up a meeting with Alek and he can make sure that you get the pricing for, the needed usage.
Allie, I saw one other question pop up. Typically, how long, if someone wants to use search in their organization, how long does it take us from the time, and maybe Maddie, you can help with that, from the time they say they want to have it to getting it up and running for their facilities, to use in their facilities?
Yeah, I think that Maddie would have a better answer for that one.
No problem. And I'm sorry, my camera is not working today, but hello, everybody. So it really depends on your situation and your location. If you are based in an area that we have a really thorough database of post-acute care providers, it's going to be a much quicker turnaround. But if you are located in an area that has post-acute providers that maybe aren't as active on Silver Search as they need to be, and there needs to be some outreach from us, it could be a little bit longer. But typically for a project like this, once we have the implementation started, it's a matter of weeks.
Great, thank you. Thanks for a nice, thorough answer. Allie, I don't know if we have any other questions. That was the only other one I had seen.
Well, I'm not seeing anything else come up on the chat or anything.
Well, great. If we don't have any other questions, Scott, you want to take us home?
Yeah, you bet. I really appreciate everybody jumping on the call today, and thank you to Art, Ali, Alek, and Maddie for helping us out with the presentation and for answering those questions. It was a pleasure to have all of you with us, and this concludes the webinar. Thank you again everyone for attending, and we hope you have learned and enjoyed the presentation, and hopefully we'll be in touch soon. And if you have any questions, please feel free to reach out. Thank you so much.
Thank you, everyone. Have a wonderful rest of your day.
See ya.